Hey Alpha Nurses, I'm Nurse Sandra from alphanursguide.com. This is NCLEX Brain Review Lesson 46, 50 NCLEX practice questions. You can get my notes on Etsy. Be sure to follow my store to get any updates of new notes. You can follow me on Facebook, Instagram, and TikTok for more content. All links are in the description. Without the way, let's get started.
The client with a cervical spine injury has Crutchfield tongs applied in the emergency department. The nurse should perform which essential action when caring for this client? A. Providing a standard bed frame. B. Removing the weights to reposition the client. C. Removing the weights if the client is uncomfortable. D. Comparing the amount of prescribed weights with the amount in use. The correct answer is D. Comparing the amount of prescribed weights with the amount in use. Rationale: Crutchfield tongs are applied after drilling holes in the client's skull under local anesthesia. Weights are attached to the tongs, which exert pulling pressure on the longitudinal axis of the cervical spine. The nurse ensures that weights hang freely and that the amount of weight matches the current prescription. The client with Crutchfield tongs is placed on a striker frame or rotorest bed. The nurse does not remove the weights to administer care or change the level of tension or traction based on client comfort level. The nurse has provided discharge instructions to a client with an application of a halo device. The nurse determines that the client needs further teaching if which statement is made. A. I will use a straw for drinking. B. I will drive only during the daytime. C. I will use caution because the device alters balance. D. I will wash the skin daily under the lamb's wool liner of the vest. The correct answer is B. I will drive only during the daytime. Rationale: the client should not drive because the device impairs the range of vision. The halo device alters balance and can cause fatigue because of its weight. The client should cleanse the skin daily under the vest or the device to protect the skin from ulceration, and should use powder or lotion sparingly or not at all. The wool liner should be changed if odor becomes a problem. The client should have food cut into small pieces to facilitate chewing and use a straw for drinking. Pin care is done as instructed. The nurse is caring for the client who has suffered spinal cord injury. The nurse further monitors the client for signs of autonomic dysreflexia and suspects this complication if which sign/symptom is noted. A. Sudden tachycardia. B. Pallor of the face and neck. C. Severe, throbbing headache. D. Severe and sudden hypotension. The correct answer is C. Severe, throbbing headache. Rationale: the client with spinal cord injury above the level of T7 is at risk for autonomic dysreflexia. It is characterized by a severe, throbbing headache, flushing of the face and neck, bradycardia, and sudden severe hypertension. Other signs include nasal stuffiness, blurred vision, nausea, and sweating. It is a life-threatening syndrome triggered by a noxious stimulus below the level of the injury. The client with spinal cord injury is prone to experiencing autonomic dysreflexia. The least appropriate measure to minimize the risk of autonomic dysreflexia is which action? A. Strictly adhering to a bowel retraining program. B. Keeping the linen wrinkle-free under the client. C. Avoiding unnecessary pressure on the lower limbs. D. Limiting bladder catheterization to once every 12 hours. The correct answer is D. Limiting bladder catheterization to once every 12 hours. Rationale: the most frequent cause of autonomic dysreflexia is a distended bladder. Straight catheterization should be performed every 4 to 6 hours, and indwelling bladder catheters should be checked frequently for kinks in the tubing. It is not appropriate to catheterize the client every 12 hours. Constipation and fecal impaction are other causes, so maintaining bowel regularity is important. Other causes include stimulation of the skin from tactile, thermal, or painful stimuli. The nurse administers care to minimize risk in these areas. The client with spinal cord injury suddenly experiences an episode of autonomic dysreflexia. After checking vital signs, which immediate action should the nurse take? A. Raise the head of the bed and remove the noxious stimulus. B. Lower the head of the bed and remove the noxious stimulus. C. Lower the head of the bed and administer an antihypertensive agent. D. Remove the noxious stimulus and administer an antihypertensive agent. The correct answer is A. Raise the head of the bed and remove the noxious stimulus. Rationale: key nursing actions are to sit the client up in bed, remove the noxious stimulus, and bring the blood pressure under control, with antihypertensive medication per protocol. The nurse can also clearly label the client's chart, identifying the risk for autonomic dysreflexia. Client and family should be taught to recognize and later manage the signs and symptoms of this syndrome. The nurse is assigned to care for an adult client who had a stroke and is aphasic. Which interventions should the nurse use for communicating with the client? Select all that apply. A. Face the client when talking. B. Speak slowly and maintain eye contact. C. Use gestures when talking to enhance words. D. Avoid the use of body language when talking to the client. E. Give the client directions using short phrases and simple terms. F. Phrase what was said differently the second time, if there is a need to repeat it. The correct answers are A. Face the client when talking. B. Speak slowly and maintain eye contact. C. Use gestures when talking to enhance words. And E. Give the client directions using short phrases and simple terms. Rationale: a client who is aphasic has difficulty expressing or understanding language. The nurse should face the client when talking, establish and maintain eye contact, and speak slowly and distinctly. The nurse should use gestures and pantomime when talking to enhance words, and use body language to enhance the message. The nurse should give the client directions using short phrases and simple terms, and phrase questions so that they can be answered with a yes or no. If there is a need to repeat something, the nurse should use the same words a second time. The nurse is admitting a client with Guillain-Barré syndrome to the nursing unit. The client has an ascending paralysis to the level of the waist. Knowing the complications of the disorder, the nurse should bring which items into the client's room? A. Nebulizer and pulse oximeter. B. Blood pressure cuff and flashlight. C. Flashlight and incentive spirometer. D. Electrocardiographic monitoring electrodes and intubation tray. The correct answer is D. Electrocardiographic monitoring electrodes and intubation tray. Rationale: the client with Guillain-Barré syndrome is at risk for respiratory failure because of ascending paralysis. An intubation tray should be available for use. Another complication of this syndrome is cardiac dysrhythmia, which necessitates the use of ECG monitoring. Because the client is immobilized, the nurse should routinely assess for deep vein thrombosis and pulmonary embolism. The nurse is caring for a client with an intracranial aneurysm who was previously alert. Which finding should be an early indication that the level of consciousness is deteriorating? A. Drowsiness. B. Clear speech. C. Ptosis of the left eyelid. D. Frequent spontaneous speech. The correct answer is A. Drowsiness. Rationale: early changes in level of consciousness relate to orientation, alertness, and verbal responsiveness. Less frequent speech, slight slurring of speech, and mild drowsiness are early signs of decreasing LOC. Ptosis of the eyelid is due to pressure on and dysfunction of cranial nerve 3 and does not relate to LOC. The nurse is planning to put aneurysm precautions in place for the client with a cerebral aneurysm. Which item should be included as part of the precautions? A. Limiting cigarettes to 3 per day. B. Allowing out-of-bed activities as tolerated. C. Maintaining the head of the bed at 15 degrees. D. Allowing 1 cup of caffeinated coffee per day. The correct answer is C. Maintaining the head of the bed at 15 degrees. Rationale: aneurysm precautions include placing the client on bed rest, with the head of the bed elevated in a quiet setting. Lights are kept dim to minimize environmental stimulation. Any activity such as pushing, pulling, sneezing, coughing, or straining that increases blood pressure or impedes venous return from the brain is prohibited. The nurse provides all physical care to minimize increases in blood pressure. For the same reason, visitors, radio, television, and reading materials are prohibited or limited. Stimulants such as caffeine and nicotine are prohibited. Decaffeinated coffee or tea may be given. The nurse is caring for a client who begins to experience seizure activity while in bed. Which action by the nurse would be contraindicated? A. Restrain the client's limbs. B. Loosen restrictive clothing. C. Remove the pillow and raise the padded side rails. D. Position the client to the side, if possible, with head flexed forward. The correct answer is A. Restrain the client's limbs. Rationale: nursing actions during a seizure include providing privacy, loosening restrictive clothing, removing the pillow, and raising the padded side rails in bed, and placing the client on one side, with the head flexed forward, if possible, to allow the tongue to fall forward and facilitate drainage. The limbs are never restrained, because the strong muscle contractions could cause the client harm. If the client is not in bed when seizure activity begins, the nurse lowers the client to the floor, if possible, protects the head against injury, and moves furniture that may injure the client. The client has a PRN prescription for loperamide hydrochloride. The nurse understands that this medication is used for which condition? A. Constipation. B. Abdominal pain. C. An episode of diarrhea. D. Hematase-positive nasogastric tube drainage. The correct answer is C. An episode of diarrhea. Rationale: loperamide is an antidiarrheal agent. It is used to manage acute and also chronic diarrhea in conditions such as inflammatory bowel disease. Loperamide also can be used to reduce the volume of drainage from an ileostomy. A client with Crohn's disease is scheduled to receive an infusion of infliximab. The nurse assisting in caring for the client should take which action to monitor the effectiveness of treatment? A. Monitoring the leukocyte count for 2 days after the infusion. B. Checking the frequency and consistency of bowel movements. C. Checking serum liver enzyme levels before and after the infusion. D. Carrying out a hematest on gastric fluids after the infusion is completed. The correct answer is B. Checking the frequency and consistency of bowel movements. Rationale: the principal manifestations of Crohn's disease are diarrhea and abdominal pain. Infliximab is an immunomodulator that reduces the degree of inflammation in the colon, thereby reducing the diarrhea. The client has begun medication therapy with pancrelipase. The nurse evaluates that the medication is having the optimal intended benefit, if which effect is observed. A. Weight loss. B. Relief of heartburn. C. Reduction of steatorrhea. D. Absence of abdominal pain. The correct answer is C. Reduction of steatorrhea. Rationale: pancrelipase is a pancreatic enzyme used in clients with pancreatitis as a digestive aid. The medication should reduce the amount of fatty stools. Another intended effect could be improved nutritional status. It is not used to treat abdominal pain or heartburn. Its use could result in weight gain, but should not result in weight loss if it is aiding in digestion. An older client recently has been taking cimetidine. The nurse should monitor the client for which most frequent central nervous system side effect of this medication. A. Tremors. B. Dizziness. C. Confusion. D. Hallucinations. The correct answer is C. Confusion. Rationale: cimetidine is a histamine 2 receptor antagonist. Older clients are especially susceptible to the central nervous system side effects of cimetidine. The most frequent of these is confusion. Less common central nervous system side effects include headache, dizziness, drowsiness, and hallucinations. The client who frequently uses nonsteroidal anti-inflammatory drugs has been taking misoprostol. The nurse determines that the medication is having the intended therapeutic effect, if which is noted: A. Resolved diarrhea. B. Relief of epigastric pain. C. Decreased platelet count. D. Decreased white blood cell count. The correct answer is B. Relief of epigastric pain. Rationale: the client, who frequently uses nonsteroidal anti-inflammatory drugs, is prone to gastric mucosal injury. Misoprostol is a gastric protectant and is given specifically to prevent this occurrence. Diarrhea can be a side effect of the medication, but it is not an intended effect. The client has been taking omeprazole for 4 weeks. The nurse evaluates that the client is receiving an optimal intended effect of the medication if the client reports the absence of which symptom: A. Diarrhea. B. Heartburn. C. Flatulence. D. Constipation. The correct answer is B. Heartburn. Rationale: omeprazole is a proton pump inhibitor classified as an anti-ulcer agent. The intended effect of the medication is relief of pain from gastric irritation, often called heartburn by clients. The client with a gastric ulcer has a prescription for sucralfate 1 gram by mouth 4 times daily. The nurse should schedule the medication for which times: A. With meals and at bedtime. B. Every 6 hours around the clock. C. 1 hour after meals and at bedtime. D. 1 hour before meals and at bedtime. The correct answer is D. 1 hour before meals and at bedtime. Rationale: sucralfate is a gastric protectant. The medication should be scheduled for administration 1 hour before meals and at bedtime. The medication is timed to allow it to form a protective coating over the ulcer before food intake stimulates gastric acid production and mechanical irritation. A postoperative client requests medication for flatulence. Which medication from the following PRN list should the nurse administer to this client? A. Ondansetron. B. Simethicone. C. Acetaminophen. D. Magnesium hydroxide. The correct answer is B. Simethicone. Rationale: simethicone is an anti-flatulent used in the relief of pain caused by excessive gas in the gastrointestinal tract. Ondansetron is used to treat postoperative nausea and vomiting. Acetaminophen is a non-opioid analgesic. Magnesium hydroxide is an antacid and laxative. An adult client with hepatic encephalopathy has a serum ammonia level of 120 micrograms per deciliter and receives treatment with lactulose syrup. The nurse determines that the client has the best response if the level changes to which after medication administration: A. 2 micrograms per deciliter. B. 5 micrograms per deciliter. C. 70 micrograms per deciliter. D. 100 micrograms per deciliter. The correct answer is C. 70 micrograms per deciliter. Rationale: the normal serum ammonia level is 10 to 80 micrograms per deciliter. In the client with hepatic encephalopathy, the serum level is not likely to drop below normal. The most optimal, yet realistic change from the options provided would be 70 micrograms per deciliter, which falls in the normal range. A level of 100 micrograms per deciliter represents an insufficient effect of the medication. Lactulose is administered for its hyperosmotic laxative effect, thus removing ammonia from the colon. The client should also be monitored for hypokalemia, resulting from the severe purging lactulose causes. A client with a peptic ulcer is diagnosed with a Helicobacter pylori infection. The nurse is reinforcing teaching for the client about the medications prescribed, including clarithromycin, esomeprazole, and amoxicillin. Which statement by the client indicates the best understanding of the medication regimen? A. My ulcer will heal because these medications will kill the bacteria. B. These medications are only taken when I have pain from my ulcer. C. The medications will kill the bacteria and stop the acid production. D. These medications will coat the ulcer and decrease the acid production in my stomach. The correct answer is C. The medications will kill the bacteria and stop the acid production. Rationale: triple therapy for Helicobacter pylori infection usually includes 2 antibacterial drugs and a proton pump inhibitor. Clarithromycin and amoxicillin are antibacterial drugs. Esomeprazole is a proton pump inhibitor. These medications will kill the bacteria and decrease acid production. The nurse is preparing to administer furosemide to a client with a diagnosis of heart failure. Which is the most important laboratory test result for the nurse to review before administering this medication? A. Potassium level. B. Creatinine level. C. Cholesterol level. D. Blood urea nitrogen. The correct answer is A. Potassium level. Rationale: furosemide is a loop diuretic. The medication causes a decrease in the client's electrolytes, especially potassium, sodium, and chloride. Administering furosemide to a client with a low potassium level could precipitate ventricular dysrhythmias. The options of blood urea nitrogen and creatinine reflect renal function. The cholesterol level is unrelated to the administration of this medication. The nurse reinforces dietary instructions to a client who will be taking warfarin sodium. The nurse tells the client to avoid which food item? A. Grapes. B. Spinach. C. Watermelon. D. Cottage cheese. The correct answer is B. Spinach. Rationale: warfarin sodium is an anticoagulant. Anticoagulant medications act by antagonizing the action of vitamin K, which is needed for clotting. When a client is taking an anticoagulant, foods high in vitamin K often are omitted from the diet. Vitamin K-rich foods include green, leafy vegetables, fish, liver, coffee, and tea. A client is taking ticlopidine hydrochloride. The nurse tells the client to avoid which substance while taking this medication? A. Vitamin C. B. Vitamin D. C. Acetaminophen. D. Acetylsalicylic acid. The correct answer is D. Acetylsalicylic acid. Rationale: ticlopidine hydrochloride is a platelet aggregation inhibitor. It is used to decrease the risk of thrombotic strokes in clients with precursor symptoms. Because it is an antiplatelet agent, other medications that precipitate or aggravate bleeding should be avoided during its use. Therefore, aspirin or any aspirin-containing product should be avoided. The nurse is caring for a client who is taking metoprolol. The nurse measures the client's blood pressure and apical pulse immediately before administration. The client's BP is 122/78 mm of mercury, and the apical pulse is 58 beats per minute. Based on this data, which is the appropriate action? A. Withhold the medication. B. Notify the health care provider immediately. C. Administer the medication as prescribed. D. Administer half of the prescribed medication. The correct answer is A. Withhold the medication. Rationale: metoprolol is classified as a beta-adrenergic blocker and is used in the treatment of hypertension, angina, and myocardial infarction. Baseline nursing assessments include measurement of BP and apical pulse immediately before administration. If the systolic BP is below 90 mm of mercury, and the apical pulse is below 60 beats per minute, the nurse should withhold the medication and document this action. The nurse prepares to administer digoxin to a 3-year-old with the diagnosis of heart failure and notes that the apical heart rate is 120 beats per minute. Which nursing action is appropriate? A. Hold the medication. B. Administer the digoxin. C. Notify the healthcare provider. D. Recheck the apical heart rate in 15 minutes. The correct answer is B. Administer the digoxin. Rationale: the normal apical heart rate for a 3-year-old is 80 to 125 beats per minute. Because the apical heart rate is within normal range, options A, C, and D are inappropriate. The nurse notes that a client in a long-term care facility is receiving a daily dose of furosemide. The nurse writes in the care plan to monitor which parameter on a daily basis. A. Weight. B. Radial pulse. C. Hemoglobin. D. Serum creatinine clearance. The correct answer is A. Weight. Rationale: daily weight should be monitored because this reflects the fluid status of the client who is receiving a diuretic. Option B is a general assessment and does not relate directly to fluid balance. Options C and D are laboratory measurements that are not prescribed routinely by the nurse and would not be done on a daily basis in a long-term care facility. A client has been given a prescription for gemfibrozil. The nurse plans to instruct the client to limit intake of which food while taking this medication? A. Fish. B. Beef. C. Spicy foods. D. Citrus products. The correct answer is B. Beef. Rationale: gemfibrozil is a lipid-lowering agent. It is given as part of a therapeutic regimen that also includes dietary counseling, specifically the limitation of saturated and other fats in the diet. Therefore, the intake of red meats is limited. Fish, foods that are spicy, and citrus products do not affect the cholesterol level. A potassium-retaining diuretic is prescribed for a client with heart failure. Which foods should the nurse instruct the client to avoid? A. Plums. B. Bananas. C. Cranberry juice. D. Cheddar cheese. The correct answer is B. Bananas. Rationale: when the client is taking a potassium-retaining diuretic, the client should avoid foods high in potassium. A banana contains 451 milligrams of potassium. Cranberry juice contains 61 milligrams of potassium. A plum contains 48 milligrams of potassium, and 1 ounce of cheddar cheese contains 28 milligrams of potassium. A client is receiving a continuous intravenous infusion of heparin in the treatment of deep vein thrombosis. The nurse is told that the client's activated partial thromboplastin time level is 65 seconds, and that the client's baseline before the initiation of therapy was 30 seconds. The nurse identifies these results as characteristic of which description? A. Low. B. Elevated. C. Abnormal. D. Within the therapeutic range. The correct answer is D. Within the therapeutic range. Rationale: the normal activated partial thromboplastin time varies between 20 and 36 seconds depending on the type of activator used in testing. The therapeutic dose of heparin for treatment of deep vein thrombosis is to keep the activated partial thromboplastin time between 1.5 and 2.5 times normal. Thus, the client's activated partial thromboplastin time is within the therapeutic range, and the dose should remain unchanged. A client with chronic atrial fibrillation is being started on amiodarone as maintenance therapy for dysrhythmia suppression. The nurse reinforces instructions to the client about the medication. Which statement by the client indicates a need for further teaching? A. I will need to have routine follow-up with my ophthalmologist. B. I will need to use sunscreen and protective clothing when outside. C. I will periodically have blood drawn to monitor my thyroid function. D. I will stop taking the prescribed anticoagulant after starting this new medication. The correct answer is D. I will stop taking the prescribed anticoagulant after starting this new medication. Rationale: amiodarone is used for the dysrhythmia, atrial fibrillation. The medication will have no effect in preventing thrombus formation within the atria, so anticoagulants need to be continued. The medication increases sun sensitivity, so protective measures are essential. Thyroid function studies should be monitored because the medication can affect thyroid function. Because the medication can cause corneal microdeposits, follow-up with the ophthalmologist is important. A child is scheduled for a tonsillectomy, which should present the highest risk of aspiration during surgery. A. Difficulty swallowing. B. Bleeding during surgery. C. Exudate in the throat area. D. The presence of loose teeth. The correct answer is D. The presence of loose teeth. Rationale: in the preoperative period, the child should be observed for the presence of loose teeth to decrease the risk of aspiration during surgery. Bleeding during surgery will be controlled via packing and suction as needed. The nurse is reinforcing instructions to the mother of an 8-year-old child who had a tonsillectomy. The mother tells the nurse that the child loves tacos and asks when the child can safely eat one. The nurse should make which response to the mother? A. In 1 week. B. In 3 weeks. C. 2 days following surgery. D. When the healthcare provider says it's okay. The correct answer is B. In 3 weeks. Rationale: rough, scratchy foods or spicy foods are to be avoided for 3 weeks. Citrus juices, which irritate the throat, need to be avoided for 10 days. Red liquids are avoided because they will give the appearance of blood if the child vomits. A full liquid diet is allowed on the second postoperative day, and soft foods are allowed as the child tolerates them. The nurse is reviewing the laboratory results of a child scheduled for tonsillectomy. Which laboratory value would be significant to review? A. Creatinine. B. Urinalysis. C. Platelet count. D. Blood urea nitrogen. The correct answer is C. Platelet count. Rationale: before the surgical procedure, the child is assessed for signs of active infection and for redness and exudate of the throat. Because the tonsillar area is so vascular, postoperative bleeding is a concern. The platelet count result would identify a potential for bleeding. The blood urea nitrogen and creatinine would not determine the potential for bleeding, but rather evaluate renal function. The nurse is monitoring a child following a tonsillectomy. Which finding would indicate that the child is bleeding? A. Restlessness. B. A decreased pulse rate. C. Complaints of discomfort. D. An elevation in blood pressure. The correct answer is A. Restlessness. Rationale: frequent swallowing, restlessness, a fast and thready pulse, and vomiting bright red blood are signs of bleeding. An elevated blood pressure is not an indication of bleeding. Complaint of discomfort is an expected finding following a tonsillectomy. The nurse is caring for a 2-year-old child diagnosed with croup. The nurse collects data on the child, knowing that which is characteristic of this illness. Select all that apply. A. The cough is harsh and metallic. B. Inspiratory stridor may be present. C. Symptoms usually worsen at night and are better during the day. D. Symptoms usually worsen during the day and are relieved during sleep. E. It is usually preceded by several days of upper respiratory infection symptoms. The correct answers are A. The cough is harsh and metallic, B. Inspiratory stridor may be present, C. Symptoms usually worsen at night and are better during the day, and E. It is usually preceded by several days of upper respiratory infection symptoms. Rationale: croup often begins at night and may be preceded by several days of upper respiratory infection symptoms. It is characterized by a sudden onset of a harsh, metallic cough, sore throat, and inspiratory stridor. Symptoms usually worsen at night and are better in the day. A child with croup is being discharged from the hospital. The nurse reinforces home care instructions to the mother and advises the mother to bring the child to the emergency department if the child develops which symptom? A. Stridor. B. Irritability. C. Tiredness. D. Poor fluid intake. The correct answer is A. Stridor. Rationale: the mother should be instructed to bring the child to the emergency department if the child develops stridor at rest, cyanosis, severe agitation, or fatigue, moderate to severe retractions, or is unable to take oral fluids. A hospitalized 2-year-old child with croup is receiving corticosteroid therapy. The mother asks the nurse why the healthcare provider did not prescribe antibiotics. The nurse makes which response to the mother? A. The child may be allergic to antibiotics. B. The child is too young to receive antibiotics. C. Antibiotics are not indicated unless a bacterial infection is present. D. The child still has the maternal antibodies from birth and does not need antibiotics. The correct answer is C. Antibiotics are not indicated unless a bacterial infection is present. Rationale: antibiotics are not indicated in the treatment of croup unless a bacterial infection is present. For answer choice A, the question does not include any supporting data to indicate that the child may be allergic to antibiotics. A mother arrives at the emergency department with her child, and a diagnosis of epiglottitis is documented. Which of the healthcare provider's prescription should the nurse question? A. Obtain a throat culture. B. Obtain axillary temperatures. C. Administer humidified oxygen. D. Administer antipyretics for fever. The correct answer is A. Obtain a throat culture. Rationale: the throat of a child with suspected epiglottitis should not be examined or cultured because any stimulation with a tongue depressor or culture swab could cause laryngospasm and complete airway obstruction. Humidified oxygen and antipyretics are components of the treatment. Axillary, rather than oral temperatures should be taken. The emergency department nurse is gathering initial data on a child suspected of epiglottitis. Which is the nurse's highest priority? A. Check for a patent airway. B. Prepare the child for an X-ray. C. Prepare the child for tracheotomy. D. Assist the healthcare provider with intubation. The correct answer is A. Check for a patent airway. Rationale: when epiglottitis is suspected, the priorities are to maintain a patent airway and to next obtain an X-ray to confirm the diagnosis. If epiglottitis is present, the child is taken promptly to the operating room for tracheal intubation. Although options B, C, and D may be components of care, they are not the priority. The nurse caring for an infant with bronchiolitis is monitoring for signs of dehydration. The nurse monitors which method as reliable for determining fluid loss? A. Intake. B. Output. C. Skin turgor. D. Body weight. The correct answer is D. Body weight. Rationale: body weight is the most reliable method of measurement of body fluid loss or gain. 1 kilogram of weight change represents 1 liter of fluid loss or gain. Although options A, B, and C may be used to determine fluid status, they are not the most reliable determinants. The nurse is collecting data from a client who is pregnant with triplets. The client also has a 3-year-old child, who was born at 39 weeks gestation. The nurse should document which gravida and para status on this client. A. Gravida 1, para 1. B. Gravida 2, para 1. C. Gravida 2, para 2. D. Gravida 3, para 2. The correct answer is B. Gravida 2, para 1. Rationale: gravida is a term that refers to a woman who is or who has been pregnant, regardless of the duration of the pregnancy. Parity is a term that means the number of births after 20 weeks gestation. It does not reflect the number of fetuses or infants. The nurse is reviewing the record of a client who has just been told that her pregnancy test is positive. The nurse notes that the healthcare provider has documented the presence of Goodell's sign. The nurse determines that this sign is indicative of which: A. A softening of the cervix. B. The presence of fetal movement. C. The presence of human chorionic gonadotropin in the urine. D. A soft blowing sound that corresponds with the maternal pulse that is heard while auscultating the uterus. The correct answer is A. A softening of the cervix. Rationale: during the early weeks of pregnancy, the cervix becomes softer as a result of pelvic vasoconstriction, which causes Goodell's sign. Cervical softening is noted by the examiner during a pelvic examination. Goodell's sign does not indicate the presence of fetal movement. Human chorionic gonadotropin is noted in maternal urine with a positive urine pregnancy test. A soft blowing sound that corresponds with the maternal pulse may be auscultated over the uterus. It is the result of blood circulating through the placenta. A premipara is being evaluated in the clinic during her second trimester of pregnancy, which indicates an abnormal physical finding that necessitates further testing. A. Quickening. B. Braxton Hicks contractions. C. Consistent increase in fundal height. D. Fetal heart rate of 180 beats per minute. The correct answer is D. Fetal heart rate of 180 beats per minute. Rationale: the fetal heart rate depends on the gestational age. It is 160 to 170 beats per minute during the first trimester, and it slows with fetal growth to approximately 120 to 160 beats per minute. Options A, B, and C are normal expected findings. The nurse is collecting data from a pregnant client who is at 28 weeks gestation. The nurse measures the fundal height in centimeters and should expect which finding: A. 22 centimeters. B. 28 centimeters. C. 36 centimeters. D. 40 centimeters. The correct answer is B. 28 centimeters. Rationale: during the second and third trimesters, the fundal height in centimeters approximately equals the fetus's age in weeks plus or minus 2 centimeters. At 14 to 16 weeks gestation, the fundus can be located halfway between the symphysis pubis and the umbilicus. At 20 to 22 weeks gestation, the fundus is at the umbilicus, and at term, the fundus is at the xiphoid process. A pregnant client is seen in the healthcare clinic for a regular prenatal visit. The client tells the nurse that she is experiencing irregular contractions. The nurse determines that the client is experiencing Braxton Hicks contractions. Based on this finding, which nursing action is appropriate? A. Contact the healthcare provider. B. Instruct the client to maintain bed rest for the remainder of the pregnancy. C. Tell the client that these are common, and they may occur throughout the pregnancy. D. Call the maternity unit and inform them that the client will be admitted in a pre-labor condition. The correct answer is C. Tell the client that these are common, and they may occur throughout the pregnancy. Rationale: Braxton Hicks contractions are irregular, painless contractions that may occur intermittently throughout pregnancy. Braxton Hicks contractions are normal in some pregnant women during pregnancy. The nurse is collecting data from a client who suspects she is pregnant. The nurse is checking the client for probable signs of pregnancy. Which are the probable signs of pregnancy that the nurse should note? Select all that apply. A. Ballottement. B. Chadwick's sign. C. Uterine enlargement. D. Braxton-Hicks contractions. E. Outline of fetus via radiography or ultrasound. F. Fetal heart rate detected by a non-electronic device. The correct answers are A. Ballottement, B. Chadwick's sign, C. Uterine enlargement, and D. Braxton-Hicks contractions. Rationale: the probable signs of pregnancy include uterine enlargement, Hagar's sign, which is the compressibility and softening of the lower uterine segment that occurs at about week 6. Goodell's sign, which is the softening of the cervix that occurs at the beginning of the 2nd month of pregnancy. Chadwick's sign, which is the violet coloration of the mucous membranes of the cervix, vagina, and vulva that occurs at about week 4. Ballottement, which is the rebounding of the fetus against the examiner's fingers on palpation. And Braxton-Hicks contractions. The nursing instructor asks a nursing student to describe the process of quickening. Which statement indicates an understanding of this term? A. It is the fetal movement that is felt by the mother. B. It is the compressibility of the lower uterine segment. C. It is the irregular, painless contractions that occur throughout pregnancy. D. It is the soft blowing sound that can be heard when the uterus is auscultated. The correct answer is A. It is the fetal movement that is felt by the mother. Rationale: quickening is fetal movement that appears, usually at week 16 to 20, when the expectant mother first notices subtle fetal movements that gradually increase in intensity. A compressibility of the lower uterine segment occurs at about 6 weeks gestation and is called Hagar's sign. Braxton-Hicks contractions are irregular, painless contractions that may occur throughout pregnancy. A soft blowing sound that corresponds with the maternal pulse may be auscultated over the uterus. This is known as uterine souffle. This sound is the result of blood circulation to the placenta, and it corresponds with the maternal pulse. The client is undergoing an amniocentesis at 16 weeks gestation to detect the presence of biochemical or chromosomal abnormalities. Which instructions should the nurse reinforce to the client? A. The bladder must be full during the exam. B. The bladder must be empty during the exam. C. She will be given RhoGAM because she is Rh positive. D. Do not eat or drink anything 4 to 6 hours before the exam. The correct answer is A. The bladder must be full during the exam. Rationale: before 20 weeks gestation, the bladder must be kept full during amniocentesis to support the weight of the uterus. After 20 weeks gestation, the bladder should be emptied to minimize the chance of puncturing the placenta or fetus. Rho immune globulin is administered to Rh-negative women because of the risk of contact with the fetal blood during the exam. There are no fluid or food restrictions. Monitoring the fetal heart tones and the vital signs throughout and after the exam is an important intervention. The client at 28 weeks gestation is Rh negative and Coombs antibody negative. The nurse determines that the client understands what the nurse has taught her about Rh sensitization when the client makes which statement? A. I know I can never have another child. B. I am glad I won't have to have these shots if I have another child. C. I will have to have an injection once a month until the baby is born. D. I will tell the nurse at the hospital that I had RhoGAM during pregnancy. The correct answer is D. I will tell the nurse at the hospital that I had RhoGAM during pregnancy. Rationale: as described in the question, it is accepted practice to administer Rho immune globulin to an Rh-negative woman at 28 weeks gestation, with a second injection within 72 hours of delivery. This prevents sensitization, which could jeopardize a future pregnancy. For subsequent pregnancies or abortions, the injections must be repeated because the immunity is passive. While assisting with the measurement of fundal height, the client at 36 weeks gestation states that she is feeling lightheaded. On the basis of the nurse's knowledge of pregnancy, the nurse determines that this is most likely a result of which? A. A full bladder. B. Emotional instability. C. Insufficient iron intake. D. Compression of the vena cava. The correct answer is D. Compression of the vena cava. Rationale: compression of the inferior vena cava and aorta by the uterus may cause supine hypotension syndrome during pregnancy. Having the woman turn onto her left side, or elevating the right buttock during fundal height measurement will prevent or correct the problem.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.